How to cure Candida naturally. Let's start with what Candida is. Candida is a type of yeast, a fungus that's naturally found on the skin and inside the human body, particularly in certain areas like the mouth, intestines, and vagina. Sometimes, Candida can grow too much and lead to an infection. This overgrowth can happen because of a few reasons, such as a weakened immune system or an imbalance in the body's bacteria and fungi. The medical term for this infection is called Candidiasis. The main culprit behind Candidiasis is a specific species called Candida albicans, although there are other less common types of Candida that can also cause similar issues. On this episode, we'll delve into what Candidiasis is and explore some natural methods that might help in treating this common fungal infection. Next topic is, what are the symptoms of a Candida infection? Candida infections are the most widespread fungal infections in people. The signs of Candidiasis differ depending on where the infection is. If it's in the mouth, called oral thrush, the symptoms include white patches on the gums, cheeks, tongue, and throat, pain while eating, redness or soreness in the mouth, lessened ability to taste, a dry, cottony sensation in the mouth. Esophageal candidiasis typically shows up as trouble swallowing. For vaginal candidiasis or a yeast infection, you might experience itching in the vaginal area, soreness in the vaginal region, redness in the vaginal area, pain or a burning sensation during urination, vaginal discharge that looks like cottage cheese. In serious situations, a Candida infection can spread throughout the body. This means it travels through the bloodstream and reaches important organs like the heart, brain, eyes, and bones. This condition is known as invasive candidiasis, and it often comes with symptoms like fever and chills. Let's now learn about the causes of infection by Candida albicans. Several factors can contribute to the overgrowth of Candida, a type of yeast in the body. These include hormonal changes, such as those during your period or pregnancy, medications that disrupt the natural balance of bacteria and yeasts, like antibiotics, oral contraceptives, birth control pills, or corticosteroids, uncontrolled diabetes, cancer, human immunodeficiency virus, HIV, nutritional deficiencies, ill-fitting dentures, impaired immune function. Moreover, certain foods can promote the growth of Candida, as studies have indicated. These include refined sugars like glucose, some dairy products. This brings us to how Candida albicans is diagnosed. Oral thrush is usually identified when a doctor examines the inside of your mouth. Esophageal infections are diagnosed through a procedure called endoscopy. For vaginal yeast infections, the diagnosis is made by analyzing a sample from the vagina in a lab culture. Once you are infected, how can you get rid of Candida albicans? Antifungal drugs are often the first choice for treating various infections. These medications can be applied directly to the skin, taken orally, or administered through a vein, depending on the location of the infection. For some vaginal infections, over-the-counter topical medicines may be sufficient. However, most Candida infections, except for vaginal ones, usually require prescription medications from a healthcare provider. Here are the recommended treatments for common Candida infections. For oral thrush, antifungal lozenges or suspensions are applied to the mouth. In more severe cases, a medication called diflucan, which contains fluconazole, is taken orally daily for 7 to 14 days. For vaginal yeast infections, topical antifungals, such as clotrimazole, miconazole, and nystatin, are applied to the vagina for 7 to 14 days. Oral medications for vaginal yeast infections include a single dose of fluconazole or fluconazole every 72 hours for 2 or 3 doses in more severe cases. So, are there natural treatments for Candida albicans? The evidence supporting the effectiveness of natural remedies for candidiasis is generally not strong. To reduce the risk of candidiasis, certain lifestyle changes may help, although they are unlikely to treat active infections. Diet. Cutting down on foods that promote the growth of Candida, such as refined sugars and dairy products, could be beneficial. Sugar alcohols like xylitol might also hinder Candida growth. Smoking and alcohol. Quitting smoking is linked to a decreased risk of Candida overgrowth. Both smoking and alcohol use are associated with higher chances of Candida infection and its spread to the esophagus. Stress management. Stress is considered a significant factor in causing vaginal yeast infections. Techniques like breathing exercises, meditation, and activities like yoga or tai chi may help reduce stress. Sleep hygiene. Candida may thrive during sleep deprivation or chronic fatigue. To counter this, improve your sleep by creating a positive bedtime environment, sticking to a routine, and avoiding things like alcohol or computer use before sleeping. So, what supplements can help with Candida? Unlike drugs, dietary supplements in the United States are not regulated by the Food and Drug Administration or the FDA for safety and effectiveness before being sold. To make better choices, opt for supplements that have been tested by reliable third parties like U.S. Pharmacopeia or USP. However, even if a supplement is third-party tested, it may not be universally safe or effective. It's crucial to consult with your healthcare provider before taking any supplements and inquire about potential interactions with other supplements or medications. None of the following solutions have been shown to effectively treat Candida by themselves. However, they might complement the antifungal medications recommended by your healthcare provider, whether they are over-the-counter or prescription. These supportive measures include probiotics, prebiotics, vitamin D, medium-chain triglycerides, other supplements like garlic and tea tree oil. Let's quickly go over the most recent research findings. Let's start with probiotics. Probiotics are foods or supplements that have live microorganisms. These are meant to support or enhance the beneficial bacteria in your body. Some examples of probiotics are Lactobacillus acidophilus. This type of probiotic bacteria is believed to help prevent the overgrowth of Candida. Bifidobacterium is another commonly used probiotic strain. Probiotics can help prevent vaginal yeast infections by reducing the acidity in the vagina and acting as a barrier against yeasts like Candida. In a study, researchers found that when probiotics were added to regular antifungal medicines, there was a higher chance of curing a vaginal yeast infection and preventing it from coming back within a month. However, the quality of evidence from these studies was considered low. Another research revealed that only about 14% of women using a vaginal insert with 2 probiotic strains experienced a yeast infection in the first 7 months of probiotic treatment. This is significantly lower than the usual recurrence rate of around 50%. However, opinions on the long-term effectiveness of probiotic supplementation for yeast infections are mixed. Probiotics can help people with oral thrush by reducing the amount of Candida, a fungus. If you wear dentures, you might experience the most significant benefits from taking probiotics. In a study involving denture wearers who had Candida, those who took probiotics showed lower levels of the fungus, making them less likely to develop thrush. Another study focused on denture wearers with candidiasis found that a product containing 3 probiotics taken for 5 weeks reduced candidiasis to only 16%, compared to 92% in those who used a placebo. Additionally, combining probiotics with the antifungal medicine, nystatin, has been proven to shorten the treatment time for oral thrush by up to a week. Probiotics could help stop Candida from taking hold in premature babies, potentially reducing the risk of fungal sepsis, which is a bloodstream infection. However, further research is necessary to confirm this. A study discovered that lactobacillus was just as effective as nystatin in preventing yeast infections in preterm infants. Apart from probiotic supplements, many yogurts also have probiotics that might be beneficial for preventing candidiasis. Let's now learn about prebiotics. Prebiotics are like food for the good bacteria in your body. They help these friendly bacteria grow and thrive, which can help keep harmful fungi like Candida in check. You can get prebiotics from natural sources like asparagus, garlic, bananas, and honey. Alternatively, there are prebiotic supplements like lactoferrin that you can take orally. It's important to note that there isn't enough scientific evidence to confirm the effectiveness of prebiotics specifically for treating candidiasis. So, what about vitamin D? In a recent medical study, it was found that giving children with serious illnesses who are taking antibiotics a daily dose of 300 international units IU, of vitamin D may reduce the risk of developing candidiasis. This brings us to medium-chain triglycerides. Medium-chain triglycerides could help protect preterm infants from Candida overgrowth in their stomach and intestines. Unlike in healthy babies, Candida can cause more severe issues in preterm infants because of their weaker immune systems. There have been limited studies on using medium-chain triglycerides to prevent candidiasis in these vulnerable infants. However, the available evidence is based on small trials, and more research is necessary to confirm these findings. Let's learn about other supplements briefly. Various supplements have been examined for their potential role in managing Candida, such as garlic, tea tree oil, thyme, grapefruit seed extract, cinnamon, ginger, oregano, peppermint, rosemary. However, we still need human data to understand whether these supplements actually affect Candida infections and, if they do, to what extent. Furthermore, you might be asking yourself, how soon after treatment will I feel better? Most cases of Candida infections typically clear up within a few days of taking antifungal medications. If you still have symptoms of a yeast infection a few days after completing the antifungal treatment, it's advisable to reach out to your healthcare provider for further guidance. So, in summary, Candida overgrowth is often addressed with antifungal medications. However, you can also use natural approaches to complement the treatment of yeast infections and oral thrush. These include dietary changes. Adjusting what you eat can be helpful. Stress management. Stress can contribute to Candida overgrowth, so finding ways to manage stress is important. Probiotics. Using probiotics, which are beneficial bacteria, can be beneficial. While some people believe in the effectiveness of supplements for Candida infections, the scientific evidence supporting their use is not very strong. Relying solely on natural remedies is unlikely to completely resolve the issue. If a Candida infection is not treated, it could potentially spread throughout the body, so prompt and appropriate treatment is crucial. If you're considering trying a supplement for candidiasis, it's advisable to do so in conjunction with antifungal medication and under the guidance of a healthcare professional. Always consult with your healthcare provider before making any decisions about treatment.
Thank you for watching. Please like, comment, and subscribe. Watch more videos by clicking on the video here.